Good day, everyone. I am here to present to you my case study on the increasing deforestation during a prolonged COVID-19 pandemic in the Philippines, the case of the Cordillera Administrative Region. The Philippines is one of the countries with the fastest and highest deforestation rates in the world, with 47,000 hectares of forest cover lost each year because of illegal logging. Since the forests act as a natural barrier and main protective agent against infectious diseases, there is a high risk for uplanders to be exposed on the viruses brought by the peoples in the lowlands. Unfortunately, the Philippines was found to lose an average of 9,601.98 hectares per year from 2011 to 2018. Large-scale deforestation, along with ecosystem degradation, could therefore pose risks in spreading infectious diseases. This situation could be worsened considering that the Philippines had a weak COVID-19 response, which led to 607,048 cases a year after the pandemic was announced worldwide. The Food and Agriculture Organization stated that the pandemic has implications on forest management activities, particularly on access of forest products and food insecurity among forest-based communities. They also added that rural to urban migration could also cause the rise of illegal economic activities in the forest. Thus, the uncontrollability of the pandemic and the increasing rate of deforestation in the Philippines would be problematic, and this could constitute a compounded misfortune. This paper therefore looks at the scenario of an increasing rate of deforestation during a prolonged COVID-19 pandemic in the Philippines. While this presentation contains information about the pandemic and deforestation on the national level, it will heavily focus on the Cordillera Administrative Region, which is home to 10 or more indigenous groups in the Philippines. But unfortunately, it is also experiencing an annual loss of about 300 to 500 hectares of forest cover. So what are the research questions? First, what are the lapses and challenges on the Philippines COVID-19 response and the country's efforts in preventing deforestation, particularly in Cordillera? Second, how will a prolonged pandemic affect the subsistence and livelihood of forest-based communities in the Philippines, particularly the indigenous peoples of the Cordillera? Third, how will a prolonged pandemic affect the operations of small and large-scale miners in the region? And fourth, how will an uncontrolled deforestation in the Cordillera affect the lives of the indigenous peoples and the locals during a prolonged pandemic? As earlier stated, a year exactly after the pandemic was announced, the Philippines had a record of 607,048 positive cases of COVID-19. The rise in cases even continued, with a streak of more than 9,000 positive COVID-19 cases for 3 consecutive days before March ended. By the end of March, there was 747,288 cases of COVID-19 in the Philippines. Unfortunately, the case of COVID-19 increased from March to August 2020, with nearly 5,000 cases on August 1. It is maintained it maintained a high case of COVID-19 individuals for the whole month, ranging from 3,000 to almost 5,000 cases. Although the trend went down from the end of August to September 8, it went up and reached more than 3,500 cases in the middle of September. It decreased and maintained 1,000 to 3,000 cases until March 2021, until it unfortunately rose to a peak of 15,000 cases on April 2. This worsened situation implies the incapability of the Philippine government to control the pandemic. In terms of the Philippine history of forest management, Carandang revealed that the forest cover has decreased drastically from 1575 onwards while accommodating an increasing population. Supplying timber to the Spanish Navy as well as the Regalian Doctrine, agricultural expansion by the elite and rich families, which caused rapid deforestation in many places, modern logging operations, and forest land conversion caused this. We can also see on this graph that from 2002 to 2020, the Philippines lost 151,000 hectares of humid primary forest, making up 12% of its total tree cover loss in the same period. The graph also shows that since 2000, forest loss in the Philippines has been intermittent, but its highest record was in 2016 and 2017, where there was only 13.4 and 13.7 million or thousand hectares of forest was lost in the country. In terms of annual tree cover loss, it was revealed that agricultural expansion was the main driver of tree cover loss in the Philippines. It is followed by forestry-related activities such as harvesting from plantations and the natural forest. It was also followed by shifting agriculture and then urbanization. Meanwhile, in the study of Carandang et al. In 2013, the direct drivers of deforestation and forest degradation in the Philippines are forest products extraction, agricultural expansion, and infrastructure expansion. These activities had impacts to the forests mainly through clearing the forest and converting it to non-forest use. The conceptual framework of the study is presented on the screen. To understand how the Philippines will become when two crises remain unresolved, this paper looks at the impacts of a prolonged pandemic in a deforested country. While it aims to provide a general understanding of how the pandemic affected forest management in general, it will focus on the Cordillera Administrative Region, which is home to more than 10 indigenous groups in the Philippines, for a more specific context. It will analyze how a prolonged pandemic can affect forest management activities in two ways. First, it will look at how a prolonged and worsened pandemic will affect the lives of the indigenous peoples in the Cordillera who sustainably manage the forests in the region. And second, it will analyze how a scenario of a prolonged pandemic will affect the operations of small and large-scale miners in Cordillera. Consequently, how an uncontrolled deforestation in the next 10 years will affect the people in Cordillera during a prolonged pandemic will also be analyzed. The research methods that were used in this study are trend analysis and visioning. Trend analysis refers to the process of analyzing historical data to project longer-term trends using statistical computation. In the study, I will project the trend of COVID-19 in the Philippines and the Cordillera Administrative Region, as well as the deforestation rate. It also uses visioning. It refers to the process of predicting scenarios about a particular issue considering particular variables. In this paper, I will try to forecast the possible situation of the IPs and the small-scale and large-scale miners in the Cordillera where there is a prolonged pandemic and deforestation in the country 10 years from now. For the first objective, I will talk about the lapses in the Philippines COVID-19 response and deforestation prevention in order to understand the present context of our situation and also to identify particular variables that we could consider for our visioning. The first three items show the weaknesses of our health governance structures, which could have caused the problems that we had in our COVID-19 experience. First, The Philippines Local Government Code of 1991 decentralized various services, such as healthcare services, to local government units. It was intended to reach marginal communities in the Philippines. However, issues such as inefficient healthcare expenditure and service delivery in far-flung areas remain. In addition, the Philippines remain understaffed. These situations affected the country's healthcare services, especially in the local areas. Second, we did not seem to learn from our experience on the SARS outbreak. The SARS outbreak in 2003 only led to 14 positive cases in the Philippines, and this is credited by our former Department of Health Secretary to effective information dissemination, community containment, and contact tracing. Such strategies could have been adapted and legalized through passing a law on protocols to follow during an epidemic, especially in COVID-19. When the MERS outbreak followed a decade after, former Senator Miriam Defensor Santiago filed a bill titled Pandemic and All Hazards Preparedness Act. This was intended to mandate DOH in making effective mechanisms to control and contain an epidemic in the Philippines. However, this has not been passed into law until the present. Meanwhile, the last two items show the critique on our country's COVID-19 response. First, there were misinformation about the pandemic. Unfortunately, the national government only acted on the pandemic 2 months after the first case of a foreigner with COVID-19 was detected in January 2020. This late action could have also explained why the first case of a Filipino with COVID-19 was detected in March. However, the Department of Health Secretary Francisco Duque denied that it is already a case of local transmission, despite the World Health Organization explaining that the case within the reporting location is already considered as a local transmission. There were also problems with contact tracing and mass testing, as requiring passengers to fill up contact forms before alighting public utility vehicles during rush hours, incidences of incomplete information of COVID-19 patients in the mobile app, which caused delay in contact tracing, and slow approval on the use of mass testing kits produced by the University of the Philippines. Lastly, the pandemic strategy of the government became militarized as military officials were appointed in key positions for handling the pandemic instead of health professionals. In terms of our lapses in preventing deforestation, Karandang's study revealed some government-related concerns as shown in the first four items. First, there were unstable and confusing and conflicting forest policies and mandates, which led to lagging bans as perverse incentives to illegal loggers. One example was the case of Surigao del Sur, where Surigao Development Corporation was not allowed to operate on their concessions, which is state-owned. Unfortunately, this led to Sudecor stopping their operations, in which their forest guards were also pulled out. This is the time when mining companies then started to tap the locality who lost their jobs from Sudecor. There were also issues on the lack of political will and coordination, corruption and collusion among government officials, as well as poor monitoring and law enforcement on the field due to the lack of forest rangers. Meanwhile, the last two items show examples of socially related concerns, such as population pressure and migration to the uplands, which could be because of the opening of mountains due to mining and logging concessions. There were also cases of over-extraction and unsustainable harvesting by the lowlanders who migrated in the uplands, and these situations show the lapses in the country's efforts to prevent deforestation. Having known the lapses in our COVID-19 response, we can see on this graph our daily COVID-19 situation, which I have already discussed earlier. Through trend analysis, we can see the projected status of our country's pandemic scenario 10 years from now. The green line on this graph shows the growth of our country's monthly COVID-19 cases from March 2020 to May 2021, while the blue one shows the result of the trend analysis 10 years from now if the COVID-19 pandemic will worsen in the Philippines. The trend analysis shows that there would be a slight decrease of COVID-19 cases from May 2021 with 607,000 or with rather 6,743 cases to a possible 5,959 cases only on June 2021. However, it might be expected to increase again in a linear manner starting with July with 6,359 cases to a 53,372 case by March 2031. On this graph shows the daily COVID-19 cases in the Cordillera Administrative Region from May 14 to June 14, 2021. From the graph provided by the DOH Cordillera, we can see that the recoveries peaked on May 18, 2021 with an almost 600 recovered COVID-19 patients. Meanwhile, the positive cases did not increase to more than 250 cases from May 14 onwards. Unfortunately, the recoveries have not been as high as what was recorded on May 18, and it started decreasing and maintained only an average of 200 cases. Through trend analysis of the COVID-19 cases and recoveries from July 2020 to May 2031, which is 10 years from now, we may expect a rise of COVID-19 cases in Cordillera, given that the pandemic will worsen and it will not be controlled by the Philippine government. Considering that the COVID-19 recoveries had up and down trend in the Cordillera, we may expect that the overall recoveries in the region is lesser than the positive cases 10 years from now. By May 2031, there could be about 4,550 cases of COVID-19 in the region, but there is only 1,613 recovered cases. This figure, however, is subjected to change if the vaccination will be intensified and the COVID-19 prevention strategies will be improved in the country. But given the situation of a prolonged pandemic, what will happen to forest-based communities in the Cordillera Administrative Region? It is envisioned or projected that by FAO that IPs in general could further be susceptible to the pandemic because they were assumed to have lower immunity and limited access to information. They might also get exposed from outsiders, such as mining operators who operate in their ancestral lands, thus being exposed to the virus. However, the IPs proved that they have established responses and coping mechanisms using their traditional knowledge, customs, and practices. In the Cordillera, the IPs will be expected to continually practice ubaya or tenggao during a prolonged pandemic 10 years from now. Ubaya or tenggao have roots on the IP's agricultural cycle, where the community requires everyone to stay at home after the planting and harvesting season. This is a time for the community and the rice fields to rest for natural nutrient regeneration. Interestingly, the ubaya or tenggao is also declared in times of epidemics where the IPs shut off their community from outsiders. The IPs in Cordillera are also envisioned to continually practice binadang and ayaw. Binadang refers to the process through which each indigenous family helps one another for sustenance through sharing food. Resources are also shared by those who have more with those who lack sufficient supply. In addition, the IPs are also envisioned to continually practice ayaw, or the process of not wasting food and water, especially during the times of an epidemic or when ubaya is implemented in the locality. It is also during ubaya that the term kasinaya or all will be well is repeatedly heard in the locality of the Cordillera. In short, the global health crisis brought by COVID-19 will continue to pose risk to the indigenous people. But the cultural practices of the IPs in the Cordillera imply that they are prepared during a pandemic. They may be marginalized and unreachable by health workers, but having lived in the uplands also distances them from the lowlands and the general public. On the other hand, let us look at the future of small and large-scale miners in Cordillera during a prolonged pandemic. While the indigenous people in the Cordillera were envisioned to successfully fight the pandemic, threats from outsiders are still evident. Converting forests to mining concessions meant less agricultural areas for the IPs, and also mining could cause drying up and contamination of water resources. For a backgrounder, in Cordillera alone, mining companies employ 17,000 workers, with over 7,000 in large-scale mining operations and 10,000 in small-scale. So in a prolonged pandemic, large-scale mining operations are envisioned to be stopped in the Cordillera region. This is considering that in 2019, for example, there was a COVID-19 surge that involved miners in the Cordillera. There was a record of 164 cases of COVID-19 positive individuals in Itogon mining concession and 131 cases on Tuba mining concession on October 25. Second, it is estimated that at least 20 tropical storms and typhoons hit the Philippines annually, and it will become more frequent during a prolonged pandemic. What would happen is that the small-scale mining activities might continue, mining communities rather, might continually become more vulnerable and possibly stop their operations, and they might need to look for supplementary livelihood opportunities. With 80% of the Itogon community belonging to artisanal and small-scale gold mining communities, they could therefore resort to the application of Minahang Bayan in their municipality. Although current practices for application for Minahang Bayan proved to be a little difficult due to COVID-19 related restrictions on travel, this could be the last and only resort of small-scale miners during a prolonged pandemic. While we would wish for everyone to earn money during a pandemic for their daily survival, we can see that the prolonged pandemic may help the environment to relax. For example, smog was lessened and fresher, cleaner air was observed in Metro Manila during the early months of quarantine and the stoppage of operations of factories. In the Cordillera alone, Assistant Regional Executive Director for Management Services of DENR in Cordillera hailed the onset of COVID-19 as a blessing in disguise. As she has explained, nature had a time to heal from environmental degradation and pollution. Now let us look at the future of the Cordillerans in an uncontrolled deforestation. We can see here on the graph, the one with the bar graph, it shows the loss of primary forests in the Philippines. We can see that it is projected to have a continually increasing rate of primary forest loss in the Philippines 10 years from now. In 2031, there could be 13,000 hectares of primary forest loss in the country, similar with the highest recorded loss in 2016 and 2017. If the national government will not be able to address the problems in deforestation, we could even lose we could even lose 19,000 hectares of primary forest in the country. This will be alarming. So what will be the fate of Cordillerans in an uncontrolled rate of deforestation during a prolonged pandemic? The Cordillera Ecological Center revealed that at least 6 provinces in the Cordillera region at the present have only between 20% to 30% of forest cover, with the province of Benguet having the least forest cover in the region. It is therefore envisioned that with the continuing massive conversion of forest lands into agricultural and mining sites, this will lead to a decreasing forest cover in the Cordillera. Thus, there could also be inadequate water supply, polluted water sources, and food shortages in the region. Specifically, if farm expansions in Cordillera Mountains continue within 10 years, water sources will be affected and the supply will decrease within 10 years. This is because the deforested watershed cannot sustain the water demands of the region. With the continuous mining and commercial farming, mercurial and cyanide poisoning could also happen, and it will affect the water condition in the Cordillera. As Business Mirror revealed, toxic pesticides and deadly chemicals find their way to the river, which the people use. It could pose health risks to the people as well, such as coughing, vomiting, and nausea. With the death of the river comes economic problems to the local community as well. Therefore, the Cordillerans might be losing forest-based livelihoods and decreased tourism opportunities. However, there's a caveat to this visioning. If we combine the two envisioned future of Cordillera in the first scenario with an uncontrolled deforestation, with another scenario in a prolonged pandemic 10 years from now, we can see some notable contradictions. For example, it is projected that the mining industry will be greatly affected during a prolonged pandemic for 10 years. And they are envisioned, as I have said earlier, to be stopped. But in the scenario of uncontrolled deforestation that I also presented, mining will still be considered as a big factor contributing to deforestation. So how does this happen? This could imply that if the Philippines will be able to improve its COVID-19 prevention strategy and the miners will get vaccinated, they might continue their operation in the Cordillera Administrative Region, even if the pandemic will worsen for 10 years. So what do we do now? Here are some of the recommendations for the envisioned scenarios. First, there is a need for a proactive mass testing and effective contact tracing mechanisms, vaccination to reach herd immunity, and implementation of science-based policies and decisions to address our lapses in COVID-19 prevention strategies and deforestation prevention. There's also a need for intensive reforestation activities and setting clear guidelines concerning forest use. Despite the IPs being able to protect themselves from the pandemic through their customary practices, their needs still have to be attended. They should be vaccinated, given health supplies, and other necessities that they need for survival. To help small-scale miners, artisanal and small-scale gold mining activities should be regulated to ensure that they won't impact the Cordillera watershed. Moreover, it is the big mining companies that causes more problems in the Cordillera and hence needed to be stopped to to avoid further deforestation in the region. As such, alternative livelihood opportunities must also be provided for the Cordillerans who were employed in large-scale mining companies. Lastly, agroforestry and organic farming that was aimed at limiting the heavy use of fertilizers and pesticides for the commercial farmers and preventing encroachment into forested areas are also suggested to those practicing intensive commercial farming in the country. With all these suggestions, it is hoped that we can avoid the envisioned future of the Cordillera region and the Philippines at large regarding a 10-year prolonged pandemic and an increasing rate of deforestation. I hope that you have learned from this case study and feel free to leave your questions below.